So we haven't got so many of the usual bits and pieces today because we're just going to focus on new DFG guidance, which hopefully you've seen came out yesterday. So we've known about it for a little while and been quite heavily involved with drafting it. So we've picked out 30 or so of the key things that I think kind of are different or important for you to know. There's about 90 pages of it, so it's not everything. It's not even every page, but some of the things that are either kind of different or interesting that we thought you should be aware of for the publication of the new guidance. And I suppose kind of the first thing to say, it is the first new guidance that's been badged by the government since 2006, so kind of 16 years ago. And it follows very much on from the DFG review from 2018. So round about half of the recommendations from the DFG review are one way or another picked up within the new guidance. So 30 or so key things that I think you should know from the new guidance. And kick off with, it's guidance very much for local authority staff and people working in home improvement agencies on how you can effectively and efficiently deliver DFG. It specifically doesn't make changes to policy or any existing regulations, but brings together in one place kind of existing policy frameworks, legislative duties, powers, and recommended best practice. So there are some things you probably haven't seen before, but they're not changes to policy. And it's very nice that the Department for Levelling Up Housing Communities and Department of Health and Social Care thanked us for our supporting developing this guidance. It's something I've kind of personally been working on for about 18 months or so, and kind of the first draft was my my lockdown homework. So it's nice to be able to talk about it after all this time of working on it. And here's some, I think, the key things that you ought to know from the guidance. So first of all, it defines what a DFG is. So it's a capital grant. It's available to people of all ages in all tenures. So that's whether renting privately from a social landlord, council, or owner occupiers. And it contributes to the cost of adaptations. And the guidance itself is divided into 7 chapters, which are listed there for you. And it also has 4 appendices at the back. So Appendix A is quite a detailed definition and guide of what capital is and how you can use DFG on kind of capital expenditure and what different categories of capital expenditure is. And it was developed during lockdown from a meeting we had with finance officers around the country, developing a joint understanding of capital and its use for DFG, and it's been adopted by the government for this guidance. Appendix B is quite a detailed breakdown of the legislation and regulations. So it goes through in some detail what the legislation says. So for anybody who's making any decisions about DFG applications, that's your kind of place to start really in terms of understanding exactly how the legislation is set out and should work. Appendix C contains some long lost consents and orders. So when the legislation was introduced back in 1996, there were a number of orders and consents that were published at the same time, but in a book, and then they never got transferred to the internet. So they kind of got lost in the midst of time. So they're now they're back out in Appendix C. So it includes things like nomination rights for landlord applications, which we've talked about in a previous webinar. And for those of you that are interested in drop curbs, it includes the clause that allows you to fund a drop curb through a DFG as well. So that's in the back of the new guidance. And then Annex D or Appendix D is a set of further readings, so it links to various resources, including the Foundation's website. But that's what's in the appendices, but I'll focus mainly on these 7 chapters today. So the ambition for government is to give more people the choice to live independently and healthily in their own homes for longer. rather than going into hospital or residential care prematurely, and recognising that adaptations can reduce the amount of formal care and support some might need. And the government will continue to support local areas to meet their statutory duties. So a continued support for DFG, and you may have seen some comments yesterday that DFG funding was decreasing. That's not the case. It continues at the current level as a baseline for the next few years. Although, as you're probably aware from the social care white paper, there will be consultations on the means test, the upper limit, and the allocations formula. So there may be some further changes that come as a result of that. And there are three ways that you can spend your funding that you get from government each year. So way number one, or method number one, is approving DFGs in accordance with the 1996 Act, your normal standard mandatory DFGs. You can spend the funding in accordance with things that are set out in your housing assistance policy using the powers from the RRO, as long as they're capital spend. And you can also use some of the funding for other social care capital purposes if that's locally agreed as part of your Better Care Fund plan. And it must be agreed with your district councils if you're in a two-tier area. And I think you've just raised this one, Ian. So council tenants can apply for a DFG in the same way as any other applicant. However, local housing authorities with a housing revenue account should self-fund home adaptations for council tenants through this account, and your DFG allocation shouldn't be used for these. Joint working is a kind of key theme that runs through the guidance, and it's about creating a home environment that supports people to live safely and independently. And it's vital that in planning the housing needs of disabled people, local housing authorities work closely with local health and care commissioners and ensure strategic join-up, including the use of DFG, to align housing, health and social care aims. This is something that's been in the guidance pretty much ever since 1996, and it's definitely reinforced within the new guidance. And something also in the 96 guidance, and again is reinforced here, is that where the social care authority determines that a need has been established, they have a duty to assist, even where DFG funding may be applicable. So in cases where maybe an applicant has an assessed contribution that they can't meet through the DFG means test, or the costs are more than the upper limit, social care authority can step in to provide financial assistance. The social care authority can provide that. It can also kind of charge and reclaim that if it wants to, but just because DFG there doesn't mean that social care no longer has any kind of duty around providing adaptations. And as I said, it kind of reinforces again that good practice for authorities to work together, hold regular meetings between senior partners, have a clear, unambiguous formal agreement on key issues like joint working and funding, about streamlining the processes between social care and housing, how they go about assessment, signposting, what the timescales should be, and who pays for what. So that's a very key part of what the government's setting out, is that kind of joint working, particularly between social services and housing, is a very key part to making this all work. And again, this kind of joint approach, ensuring that adaptations are progressed as quickly as possible. There should be a joint approach to funding. So as well as kind of complex adaptations, that would kind of their cases somewhere like hoist, for example. Sometimes the hoist may be funded through the DFG, and then the sling is funded separately through social care somewhere, and kind of delivered 2 weeks on Thursday. And yeah, somebody's got a hoist, they haven't got the sling. Actually, it should be joined up for the person who's kind of experiencing this service. And different authorities should work together and work out how the funding is spent to do that in a more joined up and seamless way. So this was a recommendation from the DFG review, and it was particularly for county areas. So where neighbouring authorities can agree to pool funding across a wider area to provide greater flexibility. So, for example, if within your county area there are, and it's fairly typical for some of the districts to have underspend while others have waiting lists, you could top slice at a county level some of the DFG funding and kind of even up the distribution across a county, which happens in some areas. Or you could top slice some of the funding for kind of particularly large and expensive adaptations that crop up from time to time. And it's recommended the operation of the pool funds should be part of the Better Care Fund plans and be overseen by regular meetings of senior officers. So that there are some counties that already do this, but I think it's very sensible and good practice for every county to adopt this approach. Working with housing providers. So we had a webinar earlier in the month that kind of focused on good practice between housing providers and local authorities, and that's referenced within the new guidance. But it reiterates here that having good working practices between housing associations, registered providers, and local authorities is good practice. They should meet regularly and have kind of communications and open engagement on issues and making sure that tenants are kept informed on progress of any work. And as we've been talking about probably for the last 5 years or so, publishing a housing assistance policy under the RRO is key to providing the flexibility that you don't necessarily always have through a mandatory DFG. So funding is primarily for the provision of home adaptations to help people living independently. I think somebody did ask about changing places facilities. That there's been some other funding announced for changing places, and the Better Care Fund planning guidance talks about this funding being specifically for home adaptations. So it is ring fenced to home adaptations rather than adaptations of kind of public areas, where it does give you quite a broad discretion to use the funding in different ways. So it may be repairs, it may be assistance to move, or other types of adaptation over and above those that you might get through a DFG. And on the Foundation's website very soon, there will be a new guide to writing housing assistance policies, as well as the guidance that's within the DFG guidance. We'll have a template and other resources that you can use to develop your new policy. And our regional advisors are always available to help you with that if you need it. Local land charges. So this is one you might want to consider as part of your housing assistance policy, in that you're encouraged not to place local land charges where the application is being made for a child in a long-term foster placement. So the thinking behind this is that foster parents are quite hard to find, and they save social services a great deal of money over and above them being, I suppose, staying within care or kind of being a looked after child. So if not putting a land charge on a foster placement encourages them, then that seems to be good practice. Throughout the guidance, the term home improvement agency is used for a service to support a disabled person and their family. So it's about being kind of a person-centered approach to supporting somebody through the adaptations process, which is, I think, a bit more than just kind of filling in the forms and supporting somebody to make an application. So it's very much recognised that home improvement agency is good practice in terms of supporting somebody through the process. And it's also good practice to consult people in the service design and how the service is delivered in your area. Just kind of pick a few points from the chat. So assistance to move, if you see Appendix A, there's some details about supporting people to move. Is there a specific threshold with assistance to move, Stephen? No, there isn't. You've got your discretion through a housing assistance policy to pretty much do what you like. Can a local authority prevent the application of a DFG for a tenant in a housing association property? No, you can't. Permission from registered providers. Question from Deborah. If you go back a few weeks and watch our webinar from earlier in the month, there's lots of tools and tips and ideas around that we published in another guidance earlier in the month. You keep popping your messages, and I'll try and keep an eye on them as well as reading this at the same time. Person-centered is another big theme that runs throughout the guidance. So the idea is that managing and delivery of home adaptation should be a seamless service for the client whose needs should be the primary focus, and that they should be involved in decision-making throughout the process, and the outcome of all discussions and agreements must be well documented with them. So you've seen this in various local government ombudsman investigations as well, actually, but it's always good practice to keep the client as involved as you can throughout the process. And as well as I suppose, a more traditional home improvement agency, there is a shift towards having more integrated teams and getting over the problem of OT services and housing services being totally separate and kind of passing the ball from one to the other. And definitely a trend towards having an integrated team to handle the whole adaptation journey from first contact through to completion of works, which overcomes many of the frustrations that clients can face when their cases kind of pass between the two. And there is emerging evidence from areas that do this, that it's a more centered way of working, reduces timescales and dropout rates. In terms of assessment teams, we discussed some of this in last week's webinar, but it's about having the right team of professionals to assess for the right types of adaptations. So trusted assessors for simpler cases, but other types of maybe kind of pediatric OTs and other sorts of OTs involving the technical officer, particularly where the most kind of complex and major adaptations are required. So in terms of key stages, I just noticed Ruth said she's used DFGs on council properties, which is definitely against the rules, Ruth. And Marita was asking about no home improvement agency in the county. The guidance still applies whether you have a home improvement agency or not. But you're definitely encouraged to use one for to support people through the process. So the guidance divides the process for delivering a DFG into 5 stages. So starting with stage 0, which is kind of the first contact and before. So in terms of public information and up until the point that the person makes contact with usually social services at the contact centre. But then the main stages are stages 1, 2, 3, and 4. And the timescales for moving through these stages depend on the urgency and complexity of the adaptations required. So it's looking at the kind of triaging as we discussed last week. So more urgent cases should be prioritised for action, but it recognises that larger and more complex schemes will take longer to complete. And table on the next slide sets out the best practice targets, which should be met in 95% of cases. So those are your timescales from 55 days for urgent and simple adaptations through to 180 days for non-urgent and complex. So just picking up on the questions around HRA funding, Department of Levelling Up Housing Communities are very clear that the the DFG allocation should not be used to fund adaptations in council housing. And just answering Ruth's point, a tenant, a council tenant can apply for a DFG, but it must be funded through the home, through the HRA, not through the DFG allocation. So in terms of first contact, authorities should put in place a pre-application process to efficiently channel inquiries into the most appropriate type of assistance, or signpost them to more appropriate agencies to help resolve their problems. And it does refer to adaptmyhome.org.uk, which you can use as part of your pre-application process. So the timescales are from, to answer your question, Stephen, so stage 1 is after somebody's made contact with your contact centre. So it's kind of 55 days from first contact through to completion for urgent and simple jobs, which is working days, which is 11 weeks. Timescales are guidance and best practice, but it's obviously what the Ombudsman will use from now on if they're assessing any delays. Triage. As we discussed last week, it's recommended that authorities use a triage system to make that initial assessment of complexity and urgency. And we showed a triage system last week that we've developed in, I suppose, working with various local authorities across the country. We have got a slightly updated version that also looks at urgency and then gives you your target timescales based on that. So we'll be sharing the link with that over the next few weeks. One of the bits that we definitely wanted to include within the new guidance was something that we looked at within the DFG review, and something that we identified that the definition of necessary and appropriate was mostly missing from all the previous guidance. There's very little in it. That there was some stuff in the 96 guidance, but in subsequent versions of it, there's very little about what necessary and appropriate needs, what necessary and appropriate means. So there's a list of things to consider as part of the assessment for necessary and appropriate that we'll be looking at much more in next month's webinar. And kind of building on a point I mentioned earlier in terms of this kind of collaborative assessment, that there's a section of the guide that looks at how an OT and a technical officer can work together to work through necessary and appropriate, reasonable and practicable, to come up with a recommended solution by working with the client. Client choice was something that we talked about at the last round of roadshows, and kind of a lot of the terms are further defined within the guidance. So relevant works are the works that meet the purposes for DFG. But there will be occasions when the client would like to consider something different or more extensive than works to their home. So for example, I suppose a fairly common example is if it's kind of assessed as needing a stair lift, but they would prefer a ground floor extension. And the guidance is advising or guiding that you should kind of support those kind of preferences, and not to seek to deny access to a home improvement agency service just because a client seeks to exercise their choice. And I think you can definitely do this with small local contractors. And I know it's been more difficult over the last couple of years, but there are definitely areas that have worked on this. And it's something we'll be picking up more over the next 12 months or so as well. So I think kind of somebody kind of commented earlier that they don't provide support in their area for people making a grant application. And again, it's very much suggested that that should be provided, including provision of drawings, specifications, planning permission, and competitive estimates, and helping an applicant to navigate the process to make a grant application in a timely manner is an essential part of delivering good outcomes. And again, kind of the section that very much encourages you to provide a home improvement agency service to offer practical help to carry out home adaptations and improvements. Service offers varies, and some agencies are independent, some are run by housing associations or private companies, but the vast majority now are in-house teams within local authorities. Standard specifications, simpler jobs, a standard instruction could suffice, but in more complex cases, a detailed specification with drawing would be necessary. And very much encouraging authorities to adopt an approach where adaptations are seen as a long-term investment in the accessibility of the housing stock. As you will know, the legislation gives up to 6 months to make a grant approval. But in the vast majority of cases, that's actually quite a straightforward process, because you've already been through all the details of it with the applicant during the kind of earlier stage of the process. So the guidance is saying that kind of from application to approval shouldn't take any longer than 5 days for an urgent case or 20 working days for a non-urgent case. And that there are plenty of local authorities across the country that already meet those timescales and exceed them. For works that go on site, it's recommended that you hold pre-start meetings between the client and the contractor to discuss things like the sequence of events, any other considerations, who to contact if there is a problem, and to sign the building contract using a simple agenda, recording all the information and sharing the details. And that investing time in setting up jobs to succeed means they're far less likely to go wrong in the future. So this is a fairly common question on Facebook, DFG surgery, or certainly emails that we get into the help box around joint residency. No particular change in policy here, that it still applies to the main residence, but as previous guidance has said, authorities are encouraged to use their discretion to consider applications where there is kind of a joint tenancy that's kind of 50-50 to ensure that normal living arrangements can be maintained. For children in foster care, and this one also comes up fairly regularly, it's an application for DFG will be made to the authority where the foster carers live. So if foster carers live in a different local authority, they couldn't apply for a DFG to the local authority where the child comes from. Although it is likely that any costs over the maximum limit would come from the foster child's social services authority. So in terms of defining your eligible works, there's kind of a 3-stage decision-making process. And this is pretty much for any DFG. So you'd first decide, does the disabled occupant need adaptations that meet one or more of the purposes that are listed in the Act? And then you decide, do those relevant works or kind of proposed, are there relevant works or proposed adaptations that would meet the identified needs for one or more of those purposes? That's kind of step 2 of the decision. And then you decide if those relevant works are necessary and appropriate to meet the needs of the disabled occupant. and then reasonable and practical to carry out given the age and condition of the dwelling, qualifying houseboat or caravan. So the reasonable and practicable bit is fairly limited in that you can only take into account the age and condition of the property. So most of the decision is around what is necessary and appropriate. And as I mentioned earlier, the new guidance includes quite a bit more detail on what necessary and appropriate actually means. One bit that is, I think, kind of new is that DFG has always had a purpose of kind of improving or providing heating for somebody who needs it as part of their disability. But the guidance includes this kind of short paragraph that under the heating clause, air conditioning or other cooling systems could also be considered where heat exposure can cause or heighten fatigue, numbness, blurry vision, tremors, confusion, imbalance, and weaknesses as associated with conditions such as multiple sclerosis. So I know some local authorities do that already, but it is in there now as one of the things you should also consider as part of an application. So this is kind of near the end of the top 30-ish of things I wanted to mention today. So this was one of the long lost consents that was in the back of the 1996 guidance that's now been reproduced. So it does allow you to include a condition within your grant approval that specialist equipment such as a stair lift may be recovered where it is no longer required. You can waive this if it's a bit of kit that you don't want to reclaim, but it does give you the option to reclaim things like stair lifts, hoists, through floor lifts, if you include that within your grant conditions. And then the final bit right at the back is where a landlord makes the application, the general consent that allows a local authority to nominate tenants to the property for the next 5 years is reprinted. So this means that a landlord would need to agree that if and every time the property becomes vacant for the next 5 years, they will hold it for letting by persons nominated by the authority for a reasonable period of up to 4 weeks. So that was a quick whiz through 30 or so of the things that I kind of picked out of the guidance.